Nursing is a highly regulated profession, rightfully so, as we literally deal with life and death every day. This next section discusses all the legal regulations and ethical issues surrounding nursing. As I said, nursing is heavily regulated. We have regulations from the Occupational Safety and Health Administration, or OSHA, that guide us on the use of electronic equipment, radiation, chemicals, etc., to keep us safe from harm. OSHA is for the employees, not for the patients, so following OSHA standards is the best thing we can do to make sure we go home safe from occupational hazards. We have obligations for when we must report certain conditions, such as communicable diseases, certain sexually transmitted diseases, and even abuse. We have several rules related to controlled substances, such as how we can give those medications to patients, counting of controlled medications, and not taking controlled medications while working. We also have laws against discrimination and sexual harassment in the workplace. These laws pertain to us as employees, but we also have a duty not to discriminate and sexually harass our patients. The most commonly discussed regulation in healthcare is HIPAA, the Health Insurance Portability and Accountability Act. There's a lot of misinformation about HIPAA, especially floating around social media. HIPAA is a federal law that protects sensitive patient health information from being disclosed without the patient's consent or knowledge. We cannot share patients' medical information with anyone without the patient's consent. We cannot discuss patient information in the hallways, elevators, cafeteria, over a fax machine, over the phone, etc. We must also ensure medical records are safe from eyes who don't need to be seeing things. So if you do not have a valid reason to open a chart, do not open the chart. We also have regulations in place related to when and how we can use restraints and seclusions for patients. And we also have regulations related to death and dying. Patients have the right to die with dignity and can write those wishes out in the form of living wills or advance directives. The Joint Commission, also known as TJC or formerly JCAHO, is an organization committed to patient safety in certain healthcare settings. Most people who work in a hospital know about TJC. They go hospital to hospital performing inspections and citing hospitals for things they are doing wrong. While it's stressful and no one likes it when TJC comes, the things they are looking for are very important. So important that every year TJC creates national patient safety goals to help prevent harm to our patients. Soon you will learn about medications and abbreviations we can't use. TJC started that. 2 patient identifiers? Yep, TJC did that. Communication between healthcare providers? Guess who was behind that? TJC. I linked a document on this slide so you can see more of the goals that were set by TJC. Nursing is a profession, and as such, we have values and virtues we must uphold. Like I said in part 1, we are the most trusted profession and we need to act like it. Some of the nursing values are altruism, which is having concern for welfare and well-being of others. Autonomy, which is the right to self-determination. Human dignity, which is having respect for inherent worth and uniqueness of individuals and populations. Integrity, which means we act according to the code of ethics and standards of practice. And social justice, meaning we uphold moral, legal, and humanistic rights. Social media has worked very hard to destroy these values in America by using hate and division. Nurses cannot act with hate or division. We do not know who is walking through the doors to see us. We must treat all our patients with dignity and respect. That is the foundation of what we do. People who cannot abide by that basic premise do not last long as a nurse. Other virtues we have as nurses is competence. The public depends on our ability to do our jobs correctly and to have the correct knowledge to do so. We are also expected to be compassionate and caring to our patients. We put the patient above ourselves. We are trustworthy and courageous. If COVID showed us anything positive, It's how much nurses care. Nurses in New York City had no idea what they were walking into. They wore garbage bags as PPE, yet they still showed up every single day. They did not run away and hide from the unknown virus of 2020 because nurses have these virtues. Nurses are the epitome of ethics and morals. We operate with the goal to do the best we can for everyone we care for, and ethics is a major aspect of that. So what exactly is ethics? Well, the actual definition of ethics is a systematic study of principles of right and wrong conduct, virtue and vice, and good and evil as they relate to conduct and human flourishing. We can take this a step deeper and look at bioethics, which asks questions such as what kind of person should I be? What are my duties and obligations to other people? What do I owe the common good or the public? Healthcare providers live in this area of bioethics, but nurses can take it even further. Nursing ethics is a subset of bioethics, a formal study of ethical issues that arise in the practice of nursing. We also have morals, which is our own communal standards of right and wrong. Nurses deal with ethical and moral issues all day, every day. We have dilemmas, problems, uncertainty, and even distress because of the things we see. Dilemmas are a clear conflict existing between two or more principles. There are a lot of ethical dilemmas in healthcare: abortion, death with dignity, to treat or withhold care, consent, short staffing, restraints and seclusion, and so many more. Problems are competing moral claims or principles when one is clearly dominant. We may have patients who choose treatments that we know are wrong and will hurt the patient, but we have to allow them that autonomy. They have the right to make their own healthcare decisions. Sometimes we have to deal with uncertainty when no one can define what the moral situation is or what moral principles apply. Death with dignity and cancer care can fall into this uncertain area. Sometimes we deal with situations where we cannot do the right thing. This is distress. We are aware of the correct course of action, but institutional constraints are a barrier. We see this in states where abortion is not legal, even in the case of life-threatening medical issues for the mother. Distress is a major cause of burnout in nursing, which we'll talk about later on. The ethical principles nurses are guided by include autonomy, justice, non-malfeasance, fidelity, veracity, integrity, and beneficence. Autonomy is respecting the right of patients to make healthcare decisions. They can make the choices for themselves. Autonomy is a very important concept in nursing, as a lot of things revolve around the patient's right to make their own decisions. One major decision people are allowed to make for themselves is end-of-life wishes. Everyone is allowed to make an advance directive, a document specifying the care the person does or does not want if they cannot make the decision for themselves. These can also include living wills, which dictate what life-sustaining measures a patient does or does not want, like CPR, ventilators, feeding tubes, or IV fluid. People also have the right to make another person their healthcare durable power of attorney. This means the power of attorney can make healthcare decisions if the patient cannot. Patients can make themselves a DNR, meaning do not resuscitate, if their heart stops beating, or if they stop breathing. This is an order written by a physician, and this can bring up some ethical situations. Non-malfeasance is avoiding cause to harm to our patients. Beneficence is doing something to benefit the patient or causing benefit to the patient. Justice is giving each their due and act fairly. Fidelity is keeping promises and commitments made to our patients. One commitment we make to our patients is allowing them the right to refuse treatment and the right to be free from unnecessary drugs and restraints. We cannot force things on our patients. If we threaten to force a treatment, that could be assault, and if we actually force the treatment, like actually touch the patient without their consent, that could be considered battery. Both of these are against the law. Veracity is being factual or accurate. Integrity is adhering to moral and ethical values. Nurses use integrity when we communicate, when we follow HIPAA, and when we document. If we document anything that is not factual, it can be considered liable, and if we verbally say something that is incorrect and it damages the patient's reputation, that could be slander. These principles are so important for nurses that we actually have a code of ethics just for us. All of the ethical principles we just discussed affect our ethical decision making. One of the biggest issues of ethical decision making is there isn't always a clear solution. We may morally know what is right, but maybe legally it's not possible. There may be more than one solution, or the solutions we have are compounded by the side effects. We see this a lot in cancer patients. The treatment may work, but the side effects of the treatment may kill the patient. What do we do in this situation? These situations require more assistance than just us. There are ethical committees who can review the patient's situation and make recommendations. We may need to get the family involved. We may need to get friends involved, clergy. We may need to get people involved we didn't even know to help these ethical dilemmas. And sometimes we need to go back to the nursing process and see if there was something we missed that may help out the decision making. On the last slide, we talked a lot about autonomy and making end-of-life decisions. Sometimes our patients have very clear advance directives and living wills, but the family doesn't agree with them. Or sometimes the healthcare power of attorney decides to go against the patient's wishes. What do we do then? Do we follow what the patient wrote when they could make decisions, or do we go off what the POA is saying when the patient cannot make the decision? Whatever the dilemma is and whatever the outcome is, we are not alone and we do not need to go through these dilemmas alone. Remember, healthcare is a team. In 2015, the ANA revised the Code of Ethics to be what it is today. There are 9 provisions to the Nursing Code of Ethics listed on the right. Briefly, nurses are compassionate, committed to the patient, need to grow in and out of our profession, and maintain integrity of our profession. If you want to read more about the Code of Ethics, I gave you a link directly to the ANA Code of Ethics website, and my guess is we might be seeing some changes in the Code of Ethics in the next couple years. We discussed that ethical dilemmas in nursing can cause moral distress. Moral distress is when we know the right thing to do, but we can't do it. This distress could lead to burnout or compassion fatigue, or it could lead to resiliency. Compassion fatigue or burnout results from chronic job stress, moral distress, trauma, or secondary trauma. There are so many factors that go into each of these. I could go on for quite a while. The biggest factors nurses are facing today is short staffing, the aftermath of COVID, dealing with our own personal issues, and maybe even dealing with patients that have similarities with people in our lives. All of these eat away at us until we either need to leave the area we are in or we get stronger from it. Remember when I said the amazing thing about nursing is we can move on to a new specialty if we get burned out or bored? If we need a change, we just go do something else. The issues with burnout is there's a high personal cost to the individual clinicians, which is us. It threatens the achievement of healthcare quality goals because we cannot mentally provide the care we need to provide. It also causes emotional exhaustion and is a barrier to our professional well-being. Being resilient after moral distress and self-care go hand in hand. Resiliency is the developed capacity to respond well to morally distressing experiences and to emerge strong. The ability to do this depends on how well you can take care of your mental well-being during distressing times. We have a commitment to our patients to provide the best care to them, but so many nurses forget that we are our own patients. We have to take care of ourselves before we can take care of others. The ANA actually defines a healthy nurse as one who actively focuses on creating and maintaining a balance and synergy of physical, intellectual, emotional, social, spiritual, personal, and professional well-being. So even a national organization recognizes the need for self-care. There are many ways we can show care for ourselves. An easy one is beginning and ending the day with gratitude. Being mindful that we have our abilities and we also know what our limitations are as a nurse and as a human. Take deep breathing breaks. Go to the bathroom. Try to make friends with your teammates. They are the only people who know what you are going through, and their support is everything. Accept that change is part of life and nothing is constant. Keep a positive view of yourself and prioritizing taking care of yourself. You are first and the most important patient. Another major topic in healthcare is malpractice. Malpractice is an act of negligence applied to a professional person, such as a physician, nurse, or dentist. To be considered negligent, the person must be deemed to have not acted as a reasonable person would under similar circumstances. The majority of reasons why a nurse could be found guilty of malpractice is by failing to act, failing to follow standards, failing to use the equipment responsibly, failure to assess and monitor, failure to communicate and document, failure to advocate for patients' needs, and failing to follow the chain of command. So what can we as nurses do to not fail at these things? Well, we can be a competent and up-to-date on evidence-based practice. We can ensure our patients get informed consent from providers, meaning the patient understands what is occurring with their care and agrees to it. We can allow patients to refuse care after we educate them. We can educate, and educate our patients. More on this in a few weeks. We can follow appropriate orders and question orders that don't make sense. We will document everything. If it wasn't documented, it wasn't done. We can delegate appropriately, and we can stay away from inappropriate social media usage. This is actually a really big problem right now. Just know that whatever you post on social media can and will be used against you. The second biggest thing we can do is be kind and honest with people. Take time to listen to their concerns. Explain to them if you are busy right now, but plan a time to come back and stick to it. Doctors and nurses who have good bedside manners are less likely to get sued. And the biggest thing we can do is follow our standards of care and our policies and procedures. They were created to ensure we do the correct thing, so we need to follow them. If you think you're about to do something that violates the standards or policies, stop and think about what you're about to do. This is the end of part 2. Please continue on to part 3.